You love
Sure,
it.
I'm down. Not very much. I mean, so you kind of tapped into like, I guess, like straight up doing the surgeries and certain procedures. But beyond that, I mean, your work schedule's
Our work schedule is very
probably
different.
very different. But
Yeah.
other than that, but that like begs one to ask. We do the same tasks. Why can't we have a schedule like that?
I don't know. Why can't we get paid the same?
Damn straight.
It's really weird. It's really weird. Our educations aren't the same. So I think because of that, it will be really hard to somewhat equalize pay.
Mm-hmm.
What is your
education? So
that's very understandable.
Give me an overview of how one goes from nursing school to NP.
So basically, where things get tricky is technically you're supposed to work as a bedside nurse for a period of time before you go to NP school.
It's not specified how long?
Correct. It used to be at least 2 years, and now many schools that I hate to say maybe are financially driven are accepting nurses into NP school who have not worked for very long. And so I don't agree with that, and I've been outspoken about it, but nurses can get into nurse practitioner school without working, like, I mean, some of them work less than a year, and they can get admitted to school. So with that being said, I worked as a nurse for 3 years full-time before going to grad school, and then I worked almost full-time through my doctorate, which was 4 years. So I had 7 years under my belt by the time I graduated, and I also knew that I was going to work in cardiac surgery ICU when I finished. So so basically we go through anatomy, physiology, pharmacology, advanced physiology, core science classes, and then like...
That's through your RN?
No, that's through, well, you do some of that in your RN, but in nurse practitioner school.
I love this. This is great. How do you introduce yourself?
I'm Danielle. I'm the nurse practitioner today.
Nice to meet you.
Hi.
So do you specify after you say that I'm the nurse practitioner that you're like the primary doctor or the primary clinical person giving them care?
I say, hi, my name's Danielle. I'm the nurse practitioner on the ICU today, and I'll be taking care of you today.
Got it.
That's what I say.
Okay.
Yeah, what do you say?
As an intern, I found that I would introduce myself as Dr. Natter. And now as a resident, especially now today I'm a 30 resident.
Woo, congrats.
You're welcome.
Congrats,
thank
woo.
you. I say I'm Mike, I'm one of the residents. And I don't know why that's changed for me. I maybe it's because I got more clinically competent, but also because I feel like it's disarming to be just like a person. And I try and like sit down with them. I try and make them feel comfortable. I like that part of it. So but I find that my female colleagues have to introduce themselves as doctor or as NP or as their title, because too often they're automatically demoted to something less than what their title is by the patients, unfortunately.
Yeah,
which is
they are.
unfortunate. Yeah,
it's cultural for sure, and I hope someday it changes. But
let's do it. Yeah.
What do you feel
that's
like
true.
attendings introduce themselves as?
Usually doctor, almost always. Yeah, almost always is doctor. There's
So like back to how you were as an intern almost? Like,
well, so like I think it's very stylistic. Like I'm sure there's some attendings that go by their first, well, probably less so. But I have a very close colleague he's at the end of his fellowship in pulmonary care, but he's like a brilliant legend at my institution. So he went through the medical school at that institution. He went through residency, was chief resident, took a year off and did an attendingship at another hospital, came back, and now was in his fellowship. And he always, he doesn't wear a stethoscope around his neck, he puts it in his pocket. He tries not to wear a white coat. He likes to sit down. He likes to say, I'm David, I'm gonna be one of the doctors taking care of you. He's very explicit. Patients in the ICU who are intubated and who are not conversant, he will talk to them as if they were. He'll explain everything he's doing. He's putting in an A-line, this is what we're gonna do, this is what you might feel. And that is the ethos and the kind of role model that I want to kind of emulate, because I think there's something to be said about that. And when I was saying doctor as an intern, it was because I was hiding behind my title because I was petrified that I didn't know enough, and I needed to, present that facade to my patients that I did know enough. And now that I'm getting more comfortable with my clinical skills and wanting to maintain what David does, I've been coming back to my first name.
So if I didn't have all of my student loans, I think my salary would be pretty good.
Fair.
But in correlation with the student loans I have, it's very difficult to think that.
Yeah, no, that's reasonable.
Yeah.
From what I can gather from the NPs at my institution, they get paid quite well, and I'd say pretty comparatively to like first year attendings on the floor. Not the same amount, but like within a reasonable derivative.
Yeah, I don't get paid that.
No.
You're also in a more expensive state, though.
This is true, yeah. As a resident, I don't really get paid very much.
No, you don't. Yes.
And so then the loans accrue as you're getting paid like just enough to pay your rent and maybe eat some food. So it's a really difficult thing. But then you exponentially go up. So depending on the fields you go into, you do some scopes in GI, you go into derm or what have you, you can make up a lot of ground in a small amount of time.
Yeah, we can't do that. Nurse practitioners can't do that.
Do you get capped out as a nurse practitioner?
Pretty much.
Okay.
Yeah. So like what you get is what you get. Like
There's no going up the chain.
Not really.
Okay.
No. So that's it. So that's the other thing
What about
too.
administration though? What if you kind of
If you wanted to do that, I don't know that I'm that type of person,
Mm-hmm.
but pretty much every nurse practitioner that I work with has a separate job.
Really?
Yeah, because we can't, and it's mostly related to student loans. It's because we can't, with the salary that we make, we can't afford to pay off our student loans if we didn't work extra.
What about loan forgiveness programs?
Those are available, but they're kind of hit or miss. Like, we don't really know if it's real or not. Like, everyone fills out the public service loan repayment paperwork, but we don't honestly know if we're going to get it after 10 years. Yeah, so I personally am not planning on getting it, so I hope to pay off my student loans before then.
I think when you start out on this track, like medical training is like a decade long. You're in your early 20s, or in my case, your late 20s when you start out, and you're like, I know this is going to be hard, but I can do it. And now that I'm in my mid 30s and I'm doing these like 24-hour shifts and stuff, like recognizing how physically, mentally, and emotionally taxing it really, really is, and making sure that this is what you want to do, and recognizing that it requires a good amount of sacrifice. That's probably what I would say.
Yeah, I actually think I thought that I would be, in some ways, less stressed as a nurse practitioner. I thought I would be more comfortable in the role faster, which would decrease my stress. And it turns out that that's not the case. I'm still very stressed at work, and I think that will continue at least for another year, maybe even 2. So my stress level hasn't greatly decreased since becoming a nurse practitioner. I think it's just going to take some time. So.
They've done that study about telomeres in interns. Have you heard about this?
No.
So telomeres are like, you know how your shoelaces have those little caps at the end so they don't get messed up and frayed? Mm-hmm. So telomeres are these little caps at the end of your chromosomes so that your chromosomes don't get all effed up when they replicate. Mm-hmm. And you can look at the shortening of telomeres, and it's kind of correlated to like stress and aging. And they found that the acceleration of telomere shortening when you become an intern is like exponential because of the stress and the hours and so on.
That's crazy.
Yeah. I have like no telomeres anymore. They're gone. I have frayed shoelaces.
I've never taken a nap at work. Actually, I did once. I was sick on night shift and I slept under my desk.
Oh.
Yeah. But other than that, I've never taken a nap. We can't.
When we're on our 28s,
they can.
We're legally, they're supposed to provide us an on-call room, and so like I'll take like an hour nap there. I've fallen asleep on rounds standing up before though. That's happened.
It's because when you work 28, I feel like you guys really work like almost 28 hours. Like you just never sleep. You never get to sleep.
There are times, because like you could try and find an hour to go to bed, and then inevitably like the nurse will call with this, or an admission will come in with that, and so like. And sometimes you'll like try to sleep for an hour or two, and then you'll get woken up in that REM cycle, and so you feel worse for trying to, like your body feels more tired. So sometimes you just power through, which I don't condone, and I think is inhumane and shouldn't be the case.
Agreed.
I have a question. Do you guys follow each other on Instagram?
I follow him.
I do now. I have to admit, I didn't really know too much about you prior to all this.
It's fine. I knew everything about you.
Oh.
Board Vitals brings everyone.
Yeah.
It's fine.
Danielle, I'm so glad that we got to meet and chat about NP versus MD stuff.
I know, right?
Yeah.
NP or MD.
MD.
We are not against each other.
No, PAs are cool too.
Oh yeah, they're fine too.
Yeah.
They're great.
Yeah.
It doesn't matter.
What else is there? DOs and ODs and
Could go on
DPPs and
forever.
DNT, all the thing, all the
We're
letters.
all here for teamwork, for the sake of the patient.
The patient, yes.